Medicago, a COVID-19 vaccine manufacturer with its headquarters in Quebec, its parent company has just announced it is shutting that lab down. Medicago, as you see here, our CBC News drone team flying over those headquarters, it developed the world's first plant-based COVID-19 vaccine for humans. And it was made possible in large part by a big investment from the federal government. Now, there are big questions over whether that money was well spent. First of all, the details that we've learned yesterday. Hilary Johnstone in Ottawa, the details in terms of why the parent company is making this move. What is it saying as far as its reasoning, Hilary?
Well, Heather, it's saying that there have been significant changes to the vaccine market and that it's for that reason that it will be shutting down that facility. So global demand is one thing that they have cited. A couple other things that they have said in a statement. This is the Mitsubishi Chemical Group. It is the sole shareholder in Medicago, saying, quote, the group judged that it was not viable to continue to invest in the commercialization of Medicago's development products and therefore chose to terminate all its activities with Medicago and proceed with an orderly dissolution of its business affairs. A big blow, like you say, because this had been touted as a homegrown vaccine, also the world's first plant-based vaccine. It was approved by Health Canada a year ago this month, so in February of 2022, but it did not receive emergency use authorization by the World Health Organization, by the WHO. Of course, we'll speak a little bit more on that in just a second here, but there had been high hopes for this at a time when the world was scrambling for vaccines, when Canadians wanted those vaccines as well. As you say, a big investment from the federal government, some $173 million, had agreed to purchase 20 million vaccines with the option to purchase an additional 56 million doses as well. And it had been shown to be effective, according to Health Canada as well, some 71% effective against COVID and its variants. So certainly a big blow here, but like we say, Mitsubishi, this parent company, saying that there have been significant changes to the vaccine market and it will be shutting down that facility.
You know, Hilary, when you look back to some of our first CBC News reports on Medicago and on this vaccine, going back to April of last year, there were some people back then questioning this vaccine's viability because of ties between the company, the vaccine, and big tobacco. So can you explain that connection and what people are saying about it now?
So like we say, Mitsubishi is now the sole owner, but that wasn't always the case. So Philip Morris International, which produces Marlboro cigarettes, for example, used to own about a fifth of it. The WHO, the World Health Organization, has a very well-known policy of not doing business, of not getting cozy with big tobacco. Some experts and some doctors told CBC News this time a year ago that that should have been a big red flag for the federal government before they started to invest taxpayer money, knowing that the WHO was not likely to authorize use of this vaccine because of its ties to big tobacco. Philip Morris did divest at the end of 2022, but still some lingering concerns here. Now, we have heard briefly from the health minister on all of this, saying in a statement, quote, my colleagues in the Canadian government and I will work with the government of Quebec and economic leaders in the region, particularly those in the life sciences, to protect the interests of Canada and those of workers and identify options for the future. Still some questions about whether or not any of that money that was invested will be returned to the federal government. But we've also heard from the mayor of Quebec City, where Medicago is headquartered. Of course, this is a big blow to jobs in the region. The mayor saying on Twitter that this is a pity, also saying that we have to roll up our sleeves to keep all this expertise in the field of health innovation in Quebec. Of course, jobs in that province very much at stake here, Heather.
Hilary Johnstone from Ottawa, thank you very much.
Thank you.